Tonight, we're digging deeper into a major expansion to VA healthcare benefits for veterans. They went into effect nearly 8 years earlier than originally planned. Those benefits are covered by the PACT Act, which aims to expand VA benefits for service members exposed to burn pits, Agent Orange, radiation, and other toxic substances. Its early enactment is a huge win for veterans who often have to deal with life-altering conditions following deployment.
So I didn't really think about it at the time, but everything kind of hit me when I came back, that I kind of had to take it seriously. One of the big things that affected me a lot was my breathing, especially after coming back.
Jack Stonecipher was an 18-year-old freshman at Marshall University when he enlisted into the West Virginia National Guard. He served with them for many years, then he was later deployed in the Army overseas. He loved what he was doing for our country, but he didn't know what he was breathing into his lungs would make it difficult for him to catch his breath today. Veteran Jack Stonecipher served as an Army paralegal in Saudi Arabia and Kuwait in 2021. Before his deployment, he went for runs every day.
Well, they always told us that there'd be impacts even if you didn't get hurt, but I honestly never really believed it. You know, I was fit, I was good in shape.
When Stonecipher came home, he realized something wasn't right.
I'll get winded, just like walking up half a block uphill. It's a lot tougher for me to just keep going, even just like trying to keep up with my toddler. She's running circles around me.
Now he finds it hard to breathe.
I've gotten dizzy, I've had falling spells, I'll have coughing fits, or I'll start like sweating and just kind of getting like red in the face and stuff. I've got like chronic fatigue now, like I'm always falling asleep.
Balancing work and being a husband and father is an everyday battle for Stonecipher. Memories of terrible sandstorms in Kuwait cloud up in the back of his mind.
Because of all of just the contaminated material, from the animal feces to the hard lead to just anything else in the desert, and because we'd be breathing that in for a few days.
All veterans who were exposed to toxins and other hazards while serving in the military are now eligible to enroll for Veterans Affairs health care earlier than anticipated.
What it does is it just makes it a lot easier when submitting a VA compensation claim.
And getting medical benefits will be much quicker, something that's crucial to not only his generation of vets.
Some World War II veterans, it's great, just like the VA, better late than never. So that was one thing I was happy that they pushed it up, because of course those gentlemen are dying daily. And then of course for all the gentlemen in Vietnam, by pushing it up those 5 years, they'll be able to get that critical VA coverage.
Stonecipher is in law school at Duquesne University. With every breath, he's pushing forward with the VA on his side.
I'm hoping that the trend will be greater access and expansion for healthcare coverage when it comes to veterans, especially when it comes to service-connected disabilities.